Hello and welcome to this special edition of GKW Safety Training. Training is going to be on infectious disease safety, specifically our COVID-19 plan. What we're going to do today is we want to understand what the danger is of infectious diseases, communicate a clear safety plan, and then we've got some summary and suggestions towards the end. COVID-19 is a highly contagious respiratory disease. The first case was recorded December 1st in China. That's about 5 months ago. The Chinese government then lied about it for 2 months, saying there were no cases of person-to-person transmission, and they allowed the disease to spread largely unchecked during those 2 months. Part of the danger is that it's growing fast and it's killing faster. On March 24th, there were 42,000 confirmed cases, 100,000 recovered, and 18,000 who had died from it. 7 days later, those numbers had doubled. 858,000 confirmed cases, 177,000 recovered, and 42,000 died. The number that died more than doubled, almost tripled. Here we are, April 6th. These are round numbers because the day isn't yet over, but we're probably going to end the day around 1,300,000 confirmed cases, 275,000 recovered, and 75,000 who have died. While these numbers are staggering, there is a glimmer of hope in here that we are beginning to flatten the curve, because if you notice between the 7 days between March 24th and March 31st, all those numbers doubled, except for the recovery number. People recover very slowly from this disease. But then if you look between March 31st and April 6th, the next 7 days, it didn't double, it just added about the same number between the first 7 days. So that shows we're starting to move from multiplication to addition, which is where flattening the curve begins to happen. Originally, it was doubling every 2 days. Now it's doubling. Then it got down to doubling every 7 days, and we're probably doubling every 10 days this time. So we are beginning to see flattening the curve because of the precautions that people are taking. COVID-19 is mainly spread person to person within 6 feet of each other by respiratory droplets, coughs, and sneezes that can be inhaled into the lungs, or touching a surface which has been coughed or sneezed on, and then touching one's own mouth, nose, or eyes. What's causing it to spread so quickly is, unlike colds and flu, spread of this disease is possible before people show symptoms. For several days, spreading a disease you don't even know you have. As for our work, OSHA categorizes our work conditions as a lower risk. They encourage caution. We're a lower exposure risk because we do not require contact with people who might be suspected or known to be infected, and also because our job does not require frequent close contact with the general public. Having said that, some people, by virtue of conditions, are at elevated risk. Smokers are almost at a 70% more of a risk. Out of 1,000 cases, 48 people who died were smokers versus 28 who were non-smokers. Age is also a large contributing factor. For those under 40, only about 2 out of 1,000 die. Between 40 and 49, those numbers double. When you get to 50 to 59, it's 13 out of 1,000 dying, and for those over 80, out of 1,000 people, about 22% dying from COVID-19. The presence of chronic medical conditions, such as cardiovascular disease, has seen the highest rate of increase in deaths at 132 out of 1,000 dying. Diabetes, 92 out of 1,000 dying. High blood pressure contributes to 84 out of 1,000. Respiratory disease raises the rate of death to 80 in 1,000, and cancer raises the rate to 76 in 1,000 dying. So these show risks are elevated. So let's put a plan in place. What are the controls that are necessary to address these risks that we've discussed? The most important thing you can do is frequent and thorough hand washing. When you wash your hands, take some time to do it. Spend about 20 seconds washing the front, sides, backs, and in between the fingers of your hands. Practice respiratory etiquette. Cover your mouth when you cough or sneeze. Clean and disinfect surfaces and equipment before you use them. And workers must stay home if they are sick or exposed to sickness. Know the symptoms. 88% of the people who have had COVID-19 have had a fever. 68% have had dry cough. Fatigue, coughing up phlegm, is around 30 to 38%. Shortness of breath, not being able to take a deep breath, was about 19%. Other symptoms include pain in your bones or joints, sore throat, headache, and chills. Less so, symptoms like nausea or vomiting, stuffy nose, diarrhea, coughing up blood, or swollen eyes. So be watching for these first 5 or so symptoms: a fever, a dry cough, fatigue, coughing up phlegm, or shortness of breath. Those are the main symptoms of COVID-19. Next part of our plan is focus on what not to do. Don't use other workers' phones. Don't use other workers' tools or equipment. Don't interact with crews from other trades. Don't share food or beverages with one another. Don't go inside offices or job trailers. Stay outside. And don't shake hands. As far as administrative controls, things we can do from the office that would help prevent the spread of the disease. One is to create smaller crews. Smaller crews are going to have less of a chance of spreading to one another. We might go to staggered shifts where crews are working at different times during the day to keep from interacting with large groups of people. And this month's regular quarterly drug screening we have postponed due to the COVID-19 outbreak. Some of the engineering controls we can be thinking of using in our plan are ventilation, making sure there's always plenty of moving air. Avoid face-to-face interactions with people. You can talk to someone without looking them directly in the face. Part of our plan would be PPE. Make sure you're wearing your nitrile-coated gloves and then washing your hands when you take those gloves off. Eye protection, goggles, face shields, respiratory protection, and face masks have been found to be helpful in that they keep us from touching our eyes, nose, or mouth. To summarize, we've come up with this acronym of FEAR, F-E-A-R. Face, exposure, anticipate, and respirate. As far as our face goes, your face is going to be the entry point for infection, so limit contact with your eyes, nose, and mouth. Wash your hands regularly and wear PPE, which will protect your eyes, nose, and mouth. As for exposure, COVID-19 can be passed by people who don't even know they carry it, so limit your exposure by social distancing. Stay 6 feet away from other people. And if you are sick or exposed to 6 people, stay home and isolate yourself. Anticipate. COVID-19 can live on surfaces for a very long time compared to other germs, so treat all surfaces as potential carriers. Wash them, wash your hands, don't touch a surface, and then touch your face. Finally, respirate. Respirators do limit, but not eliminate, the potential for respiratory infection. If you do cough or sneeze, it doesn't mean you're infected. It is allergy season, so watch for those other symptoms other than just coughing and sneezing. If you do cough or sneeze, consider that you might be infected. Use your sleeve as a respirator and cough or sneeze into your sleeve. We do request that you go to the following survey link and log your attendance to the safety training meeting. Thank you for attending the safety training meeting. Please be safe and be well.